Good afternoon. I am Professor Joe Thomas. Today, you could see many other political leaders, senior officials, describing COVID pandemic as a war and a war-like situation. They even sometimes call the healthcare workers who are dealing with the coronavirus and its after effect as warriors. I'm here to question the logic behind this, calling coronavirus related pandemic, dealing with it. It is not a war. And what we're trying to deal with it today, we are trying to deal with a public health emergency which is snowballed into a humanitarian crisis. And we are trying to deal with a complex situation which requires complex analysis, complex methods to understand it. And the war imagery, war analogy has little to do with understanding, analyzing, and approaching this pandemic. Let me explain it. Let's begin with the values of war. War is about domination. War is about plunder. War is about aggression. And war is often about just they deal with the boundaries. Human security is nowhere part of the boundary security. Whereas the people who are dealing with the coronavirus, the pandemic, and its after effect are nurses, doctors, healthcare workers, and particularly those who are in the community health workers. They're trained to save lives, whereas soldiers trained to kill. Soldiers are trained to destruct. The healthcare workers are trained to provide support, care, and counseling to the sick, to the old, to the infirm. And how you can find parallels between these two, I fail to understand. Not only that, I'll question that ideology, that approach itself. And also let's look at a little more carefully this entire phenomenon. We are using a humanitarian crisis to justify the war machinery and the warmongering, is it? And also there is an interesting question to the people who are promoting and using war analogy for understanding this pandemic. Number one, there are millions and trillions are spent on the military equipments. There are millions are spent on military, the so-called military intelligence. None of this could help to understand, to detect, even to predict which way the virus is going to go. The pandemic preparedness was never helped by a military intelligence. But still we spent trillions to maintain those equipments, instruments, that apparatus. Whereas today, the healthcare workers who are trying to save your life, they don't have basic equipments, personal protection mechanisms. Look at the irony of it. And we don't have basic essential equipments, ventilators, to save lives. But we have money for spending on the most advanced satellite system and systems to destroy the satellites, which can be used for military purpose. So this is a time we have to really look at our priorities of defense against the priorities of human security. Probably when national governments do the next exercise for allocating money for the budget, take a look at what's the priority. The priority is about human security, protecting our weak, protecting our vulnerable, protecting the sick, protecting those who need care. Militaries are boundaries. Their botheration, their preoccupation is about boundaries. There should be some balance between the resource allocation for military and the money we spend on human security, either healthcare workers. And this is also an opportunity for us to look at the basic needs of strengthening our primary health care, our healthcare system, training our nurses, training our doctors, training our community health workers, and paying them a reasonable wage. And in many countries, there is no comparison, there is no balance between the money they spend on the so-called national security. I would say the national security is always about the security of the human